Hi, everyone. It's Dr. LaTowsky. How are you guys? Can you guys hear me? Everybody good? All right. We're good? Awesome. Thank you so much for tuning into our webinar today. And actually, can we turn that off? Thank you. Thank you so much for tuning in our webinar today. We are talking about brown spots. How do we have a better complexion? We treat our brown spots. So here are the solutions I'm going to speak with you about today. And these are solutions for treating the blotchiness of our skin so that it is baby fresh. Remember the last time you looked at a baby and you just thought to yourself, look at their skin. It's amazing. And why is that? It's because their skin is so smooth and so flawless in terms of splotchiness. They're not splotchy. They don't have red splotches. They don't have brown splotches. It's just all homogeneous with one color. So I'm going to talk to you about chemical peels, intense pulse light devices, Fraxel, liquid nitrogen, and electrocautery. And we can use these all together. We can use a multi-modality approach or a multifaceted approach to treat the brown spots for your best results. So here are some examples of sources of brown spots. So on the far left, we have melasma. We also have blotchiness from post-inflammatory hyperpigmentation and actually also erythema, for instance, from breakouts or from scarring, surgical scars, or from rashes. We also, on the right, probably most commonly, we deal with sunspots and age spots, especially in sunny climates here in Arizona. So we are going to talk about all these ways we can address. And that's one of the reasons it's nice to be able to use multiple different things to treat you, because sometimes we have a potpourri of things going on. And so it's nice to be able to treat them to full capacity using several different approaches. So what can cause hyperpigmentation? Usually genetics are contributing, so there's not much we can do about genetics themselves, but thank goodness for some of us, we have things that can help us improve upon our genetics. So even if someone's prone to hyperpigmentation, we have treatments to take the hyperpigmentation away. So technology is a beautiful thing. Sun exposure, again, a problem for us here in Arizona. Many of us are here because we love the sun. We love being active, or maybe we used to love the sun. We grew up on the beach, not me specifically, but you may have grown up on the beach. You may have gone boating and not used as much sunscreen as we would have liked. And now we're seeing the repercussions of that. Some medications, for example, minocycline, Plaquenil, can cause hyperpigmentation. And so there are multiple different causes of this condition. So melasma, I mentioned melasma earlier. Melasma is one cause of hyperpigmentation. It's a condition where there's these blotchy patches on the face. So they're oftentimes irregularly shaped. The patches are typically on the cheekbones because the cheekbones stick out a little bit and the sun can hit the cheekbones and contribute to the melasma. They're often here on the sides of the forehead, and then they can be on the famous mustache area. A lot of pregnant women feel like they see a mustache during pregnancy. And then it can go over the nose too. The pigmentation from melasma can wax and wane. So it can get better, it can get worse. Well, when can it be worse? In the summer, because sun can contribute to the melasma. So melasma is difficult to treat. One of the reasons it's difficult to treat is because it's related to genetics. We can't change our genetics. We can do things to improve the conditions influenced by the genetics, but we cannot change the genetics. So the genetics can really influence melasma. Hormonal changes, such as pregnancy, hormonal treatment, HRT, hormonal patches, pellets, etc., can really affect melasma. So those two things alone make it really difficult to treat because the source of the condition is not able to be changed. Also, sun exposure can make melasma worse, and heat can make melasma worse. So now you realize why melasma can be such an issue in Arizona. And women are more likely to develop this condition than men, probably because of the hormonal component. But we can see this condition in men as well. And again, there tends to be a patterned look to it. So forehead, cheeks, nose, and mustache area. Doesn't have to include all of those areas. So let's talk about some of the treatment options that we offer. So chemical peels are one of the treatment options I will be educating you on today. What is a chemical peel? Chemical peel is a layer of liquid that's placed on the skin, and then the liquid has an action. And usually that is to stimulate exfoliation, to stimulate collagen production. And when that happens, there can be peeling of the skin. There doesn't have to be, but there can be peeling of the skin. But the point is the surface layers of the skin are turned over, and the healing process produces collagen and gets rid of pigment. So what can chemical peels treat? Chemical peels can treat melasma, post-inflammatory hyperpigmentation. That's pigmentation from acne spots or other sort of rashes, surgical scars. They can treat sunspots, age spots. They can treat acne. They can treat redness left over from acne, fine lines, and large pores. So we love chemical peels because it's a really easy thing to do to treat a variety of conditions. So one chemical peel will help all of these things, and it's very mild treatment. It is done in our practice. Most of the chemical peels in our practice are done by our estheticians, and it's extremely easy as a patient, and it can be a very relaxing experience. So here are some examples of the chemical peels that we have. So we have many different chemical peels, but these are three varieties that we have. So there is an Epion's Refresh peel, and the ingredients are malic acid and salicylic acid. So this is going to help patients who are wanting some anti-aging treatment. They want exfoliation of their skin, so therefore a brighter complexion. They want, they may be acne prone, so it helps with acne as well as redness, and there is no downtime with this peel. So in other words, even despite the fact it's called a peel, your skin does not peel. Microscopically, it's turning over faster, and that's what gives us a fresh complexion. But what's great is that we don't have to have the downtime, so we don't have to slow our lives down to have this refresh peel. So we really, really love this peel in our practice. Next, we have a glycolic peel. Glycolic peels can come in different strengths. And so we have strengths of 20, 50, 70% glycolic acids. And this is a medical grade glycolic acid. So it's a little bit different than what you see over the counter. Glycolic can help skin tone, texture, fine lines, wrinkles, hyperpigmentation, skin dullness. There's can be zero downtime with this peel. If you are doing a 70% glycolic acid, a lot of times you will peel. This is something that you can customize. So you will speak with your treating provider and they will help you decide what type of peel is going to be right for you at this time. And they're going to take into account what you want to treat on your skin, what condition your skin is in the day you come in, what social events you have going on, what work commitments you have. All of this is customizable. And these are medical grade peels done by medical professionals. These peels, incidentally, the glycolic peels can be done on pregnant women. This is how I maintained my skin when I was pregnant. A lot of you know Nadia, our lead esthetician. She was doing dermaplaning and glycolic peels every 6 to 8 weeks during all 3 of my pregnancies. And that was an absolute lifesaver for my skin because I suffer from all these things: hyperpigmentation, melasma, redness, acne. So those peels help to maintain my skin during pregnancy and breastfeeding. And then finally, the peel we're going to talk about today is called the Vitalize peel. The Vitalize peel has 3 active ingredients in it: salicylic acid, lactic acid, and retinol solution. I really love this one. In fact, we all really love this one here because it's a combination approach. And so each active ingredient is going to be a little bit different. There is going to be some overlap in there's going to be overlap in what they're going to do, what each component's going to do, but they're also going to be slightly different. So different mechanisms of action. And that means the 3 ingredients, 1 + 1 + 1 is going to equal 10. You're going to get a great, great, great result. So again, you're going to get a little bit more peeling, but it's going to be a little more bang for your buck. You're going to get more targeting of the fine lines, wrinkles, skin tone, acne scarring, pigmentation, and that you get some peeling for 1 to 3 days. Excuse me. Here's an example of before and after chemical peel. You can see this patient's hyperpigmentation. In the after photo, you really see how her skin glows and the hyperpigmentation has been lifted. So look how glowy her skin is in the after. So this was a patient treated by Nadia, our lead esthetician. Here's another one of Nadia's patients. This is after a Vitalize peel. So actually 3 Vitalize peels. You can see her acne is significantly improved. Her redness is significantly improved. Her skin tone and texture is significantly improved. And she had a little bit of hyperpigmentation. It is improved. So we get all of these things with one modality, Vitalize peel, done 3 times. And even after 9 months, her skin still maintains its youthful glow and its improvement. So the 9 months after the 3 peels, you can still see she's got beautiful improvement. And look at her collagen in the last picture on the right. You can see that she just has this beautiful collagen, this beautiful glow to her skin that's sustained. So moving on to intense pulse light. Intense pulse light is a technology that has been around for many years. This is a photo of me getting intense pulse light on my chest. I'm a huge believer in it. It's not a laser. It looks and acts like a laser. And this is the treatment you're going to see today. This uses non-coherent light. So a laser is going to be a very narrow wavelength of light. This is broadband light that's distributed over a range of wavelengths. And this is going to, because of that, it's going to do a little bit of everything. It's really going to help brown spots. That's where it really shines. But it also stimulates collagen, which improves the health and texture of our skin. It helps with the pore size. It will help a little bit with readiness as well. I am a strong believer in doing an IPL every 6 months. If you do an IPL every 6 months, your skin will look younger, and biochemically, this has been proven, biochemically, it acts younger. It is secreting cytokines that are typically made and produced in our 20s and go down as we age. The skin starts to act younger if you do the IPL every 6 months. It's really a cool technology, and it's very easy to do. The first time you do this treatment, you might have some downtime. The brown spots get darker. As you do the treatments, the more treatments you do, eventually you get to the point you have no downtime. Whenever I have an IPL done, I have no downtime. You can't even tell I've had anything done. So it's super easy to maintain no brown spots and to get a glowing, youthful complexion. So it can help all these things: skin tone and texture, sunspots, age spots, known as keratoses, melasma, sun damage, skin redness, and post-inflammatory hyperpigmentation. Here's an example after treatment. So this patient had 2 treatments. Nadia treated this patient. Look how her complexion cleared up. And if she had more treatments, it would continue to do so. But that is a dramatic improvement in the brown spots and also the health of her skin. Look at how the skin looked kind of just weathered in the before picture. Afterwards, the skin is super smooth, it's healthy looking, it's got a youthful glow, and that's because she had 2 treatments of IPL. Here's an older gentleman, and he had 1 treatment of IPL. And again, talking about multimodality approach, the spots that remain, I could easily freeze them with liquid nitrogen and they would go away. But you can see, even just using 1 treatment, 1 device, he's got nice clearing of these brown spots. So patients of any age can use this device. This patient was absolutely thrilled. And you can see in this view, this emphasizes how much better his skin looks. So not only are his brown spots gone, a lot of them are gone, the skin looks healthier. It's glowy, it's dewy. It looks really, really nice, and it helps increase the confidence of our patients. Here's a patient. She's had 1 treatment of IPL. Look at the beautiful change. And I suspect I also treated some of these spots with liquid nitrogen, but she looks great. Not only do the brown spots look great, but her skin tone and texture looks great. And again, before and after, what a dramatic improvement. Here's someone's chest. We can treat face, we can treat neck, we can treat chest, we can treat hands, we can treat forearms. We can just keep going. So here's someone's chest. Here's someone's hands. Look not only at the change in the brown spots, but at the health of the skin. Look how the skin is just glowing afterwards. Before and after, the lighting's a little bit off, but look at the number of brown spots she had, the before versus after. Before versus after, look at the beautiful tone and texture of her skin, in addition to the reduction of her brown spots. Chest, before and after. The skin looks so healthy and youthful and much less speckled. Before and after, again, talking about multimodality. This is 1 IPL, and that we improve the texture by Nadia treating her with 1 clear and brilliant treatment on her, laser treatment on her chest, which is a mild version of Fraxel, which we'll talk about next. Here I am getting the Fraxel, proof that I practice what I preach. This device, the Fraxel Dual, is a non-ablative laser, and it's a skin resurfacing. So it does a lot more per treatment for the tone and texture of the skin. So this treatment's actually designed to create a bright complexion and youthful appearance without extensive downtime, but you do have more downtime than the treatments we've talked about thus far. You have about 1 week of downtime. It targets aging and sun-damaged skin and is FDA cleared to treat precancerous spots. So not only will it help our brown spots, it also is going to treat the precancers, the actinic keratoses. It stimulates the growth of new and healthy skin cells, so it actually permanently increases the health of your skin and can be used throughout the body as well, and is a gold standard for treating scars, both surgical scars and acne scars. Here I am very enthusiastically waiting to treat a patient with the Fraxel. I love this device. This is my favorite device that we have because it's very impactful on the health of our skin. So treats a little bit of everything: fine lines, wrinkles, brown spots, acne scars, hyperpigmentation. It improves pore size, tone, and texture of the skin and results in smoother, fresher, and younger looking skin. Here is an African American patient, so safe in all skin types. We love that about the Fraxel laser. She has some hyperpigmentation and she has some acne scars. So this is after one treatment of Fraxel. And here she is 1 month after one treatment of Fraxel. And we are continuing to Fraxel her, by the way. So she will get better and better results. This patient was treated by Maya, our nurse injector. Here's another patient treated by Maya. So not only does this patient have removal of her brown spots, so look at her forehead, look at her cheekbone, look at her chin, but also look how beautiful her skin is after 1 month after treatment. Look at the healthy glow, the reduction in the fine lines, and just look how much more youthful it looks. Same patient, other side, improvement in the brown spots, improvement in the tone, texture of the skin, improvement in the fine lines. Look at her right forehead there, and you can see the fine lines have faded, and that goes with that all over the face. I always like to show my husband in these videos proof that I practice what I preach for myself and my husband when I can drag him in the office, and he always comes unwillingly. But here he is. This is after one treatment. You look at him, you might not think he has the worst skin, but he's extremely sun damaged, and you can see that after one treatment, he's got an incredible improvement in the brown spots and his tone and texture. And if you look carefully at his nose, you can see reduction in the blood vessels and improvement in his acne scarring. Here's a close-up of a patient to demonstrate improvement in the brown spots and the skin texture and the pore size. This was 1 month after one treatment. Again, 1 month after one treatment, you can see a reduction in the brown spots. Again, if I use a little liquid nitrogen, I could take care of the rest of the brown spots. You look at the beautiful improvement in the crepiness of her skin. This patient was absolutely thrilled. Here I use multimodality. I use a combination of Fraxel and liquid nitrogen to treat her brown spots. And she also got a beautiful glow, improvement in her fine lines, reduction in her wrinkling. She was extremely happy with the treatment. Here we have improvement in the texture of the skin after one treatment. Look at the skin in the middle of the chest from side sleeping. You can see those fine lines. Afterwards, you see that everything looks very smooth. And here's a patient. We're mainly treating this patient for precancers, but you can see he had a reduction in his brown spots. This is 1 month after one Fraxel. I just saw this patient within the last week, and he's extremely happy in the reduction of the precancerous and the precancerous lesions and the brown spots. So this is an example. The lighting is very bad here. This example of improvement in melasma after Clear and Brilliant, which is basically a baby Fraxel. So 2 more quick modalities that I'll talk about before we move on to our presentation or our live demonstration. Liquid nitrogen is often an adjunct I use for hereditary spots. Hereditary spots, also known as seborrheic keratoses, are microscopically thicker than sunspots, and so lasers do not remove them. IPL does not remove them. However, liquid nitrogen removes them. Liquid nitrogen is a liquid form of nitrogen. It's actually a gas form of liquid nitrogen that is negative 320 degrees. And it can be used to treat various conditions, including precancers and also age spots or genetic seborrheic keratoses. So I often will combine these modalities. And so liquid nitrogen works to freeze stubborn brown spots. We talked about that. Also, electrocautery is a procedure that uses heat from an electric current to remove targeted tissue areas. So the electric current passes through an electrode that is placed on or near the tissue. So I basically buzz it, it feels like a little bit of a heat, and then the spot gets scabby and will fall off. So we can treat hereditary dark spots and age spots with this modality as well. And this can also be used to treat sebaceous hyperplasias, little tiny oil glands that come out on the face, bumps on the nose, etc. So there's a lot of times I'm using different modalities in the same visit to get the best results. In fact, today, on one of my patients, I used Fraxel laser, then I did liquid nitrogen, and then I did some electrocautery on this patient, and she's going to have the best results, and I was just pulling out all the tools to treat her. So our giveaway is this our Isden Melon Clear Advanced Serum. This is one of our newest products that we just added, and it has some really amazing ingredients in it, including tranexamic acid, niacinamide. So it basically, the tranexamic acid will fade brown spots, the niacinamide will fade red spots, and it's got some other botanicals in it as well. And the overall effect is for a clear complexion. We have had great feedback on this. I am using this myself right now and loving it. This has been a really great product. So here we go. We will talk about, oh, and this product is valued at $175. So anyone who's attending this webinar will be entered to win this giveaway, and we will let you know. Okay, so for our webinar specials, we have 3 different levels, and we are going to focus on the different modalities just to keep it easy today. So level 1 is a chemical peel promotion. You will get a series of 3 chemical peels, and they will be individualized to your own skincare needs. So the cost for this promo is $400. The regular is around $600, kind of depending on the peel that you would choose. So that's a 30% savings. Level 2, IPL treatment. IPL and that's intense pulse light, and that's what I'm going to be demonstrating today. IPL for face, neck, and chest, all 3 areas. So that's a value of $1,300, and we're offering that for $1,000. So that is a 26% savings. And then level 3 is Fraxel. And that's what I had just talked about. One of the last modalities I talked about, a laser treatment that will help with brown spots, precancers, tone, texture, pores. And so we're offering Fraxel for the face, including our famous and well-loved post-care kit. This is valued at $1,550, and we're offering it for $1,250, $1,250. That's a 20% savings. So these promos are just for you. We thank you so much for joining us and for watching, and they will be valid through purchase today through the weekend. And you will be able to purchase online, or you can call our cosmetic number right now, and we will we will get you scheduled and committed. So please call today or click on the link this weekend, because starting Monday, these offers will no longer be available. And due to limited availability, webinar specials are final sale, non-refundable. Levels 1 and 2 are valid with our estheticians and our nurse injector Maya. Level 3 is valid with our nurse injector Maya and our physicians. So hopefully you feel like these are a great value for you and are excited about trying one of these modalities. Now we are going on to our live demo. I am just going to pause for a moment while we reposition, and I will be using the IPL on our beautiful model's hands. We'll be right back. Okay, guys, hi. Here we are, and I am ready to treat our beautiful model, Maggie. Maggie is very brave today because she has never had any cosmetic treatment done today. So or any cosmetic treatment done ever. So she has never had a laser done, and she hadn't even remember having any liquid nitrogen done, although we think maybe she's had that done before. But anyway, so she's being extremely brave. She's on camera. She's got her eyes covered for safety, and she is willing to let me treat her. So thank you so much for volunteering for this. Okay, so here she is. She's going to treat her hands. Here we are. And I am going to do one little test spot. Here we go, Maggie. 1, 2, 3. Okay, how did that feel?
Didn't feel anything.
Oh my gosh, she's been numbing. We take our numbing very seriously. So she has been numbing for a while. And this is exactly what we want. We want our patients not really feeling any discomfort. So I am always looking for the skin's response to treatment. So I'm just looking to see if this is a great setting for her. And I think it is. I got some slight darkening of the brown spots that I treated. So this is great. So here we go. I'm going to do a few more pulses, Maggie. Let me know if anything's sensitive. So you can see I'm able with this handpiece to cover a large surface area and quickly. How you doing, my dear?
Good.
And the hands are a small surface. I'm going to grab a gauze here. The hands are a small surface, but they're very sensitive. There's a lot of nerves in the hands. And so we, like I said, take this numbing very seriously. We want to make sure you're as comfortable as possible. You can see this is a very easy treatment. You are being such a good model. You're just like moving your hand exactly the way that makes it easier for me. Great job. Okay, and so while I'm going to treat her fingers here, are there any questions from the audience? Awesome. Good job.
But does IPL take care of small skin tags?
IPL does not take care of small skin tags, but that's where those last two modalities that I talked about, the electrocautery and the liquid nitrogen, that's where those two treatments come in. So if skin tags are the only concern, we can use either electrocautery or liquid nitrogen or both treatments to treat. How you doing, Maggie?
Good.
Are the fingers more sensitive or a little bit? I'm sorry, dear. Oh, you're awesome. She is doing so well. And so if you have brown spots coupled, oh, sorry, dear. You have that one. If you have brown spots coupled with skin tags, then we can use the IPL and then later use a different modality to treat. And so I want to show you, this hand is done. I want to show you how it looks immediately afterwards. There's no redness. These dark spots just look a little bit darker. And so this is exactly the endpoint we're looking for. And so the darkness will last on the hands. It will last about 10 to 14 days. On the face, it will last 7 days. And so it's a very quick recovery, and there's no redness, there's no peeling. You're able to put makeup on. So it's really kind of nice to be able to have something so easy to do. So give me a second. I'm going to move this device over. Is there another question? Oh, actually, Maggie, do you mind if I just I'm going to lay a cord over your lap. Is that okay?
Fine.
Okay, my dear. Thank you. I know you're great. You're great. Thank you. Okay. Yes.
Question says, is Fraxel the only or recommended treatment that will work on darker skin tones to lighten dark spots on the face?
Fraxel and the mini Fraxel, which is clear and brilliant, will work on darker skin tones. I will have you move this one, my dear. Thank you. Perfect. The IPL can be used on darker skin tones, but it's used with extreme caution. So because we have the luxury of having the Fraxel and the Clear and Brilliant, which again is like a mini Fraxel, it's a lower power version of the same wavelength, then we typically use those lasers on darker colored skin. How are you doing on this side, Maggie? You're awesome.
We have another question.
Okay.
Do you
Shoot.
know if, and excuse my pronunciation, do you know if treating seborrheic
Keratoses, yes, good.
with electrocautery
Right,
is covered by Medicare? Interesting.
No, it is not, unfortunately. I'm so sorry to report it is not. Our charge is $200 for around 15 of them. And patients are very happy with the treatment. Once you get rid of those pesky skin tags, it's like, why didn't I do this sooner? So I highly highly recommend considering it, but I'm sorry to report Medicare will not cover it. Good job.
Does IPL do anything for precancerous spots or just the Fraxel?
Just the Fraxel by itself, but actually there is a trick that we can use with IPL to get the precancers to go away. I am going to tell you about that. 1 second. I want you to take a look at her hand on this side. You are all done, my dear. Good job. I will torture you with a little bit of freezing, but with the IPL, you're done. See, her hand is darker on this side. And that is exactly the endpoint we're going for. Okay, so I'm going to come around again and we are going to freeze some spots for Maggie. Now, let me tell you about treating precancers with the IPL. There is something called blue light treatment or Levulon treatment, also known as photodynamic therapy. Photodynamic therapy is when we put a solution on the skin and it makes the precancer sensitive to light. And typically we use a blue light to treat the precancers after the liquid is placed on. With the Levulon or the photodynamic therapy, I can actually apply it to the skin and activate it with the IPL. So we are hitting 2 birds with 1 stone. Now, insurance will often cover the photodynamic therapy, the chemical part of it, where we put it on and it makes the precancers more sensitive to light. However, it will not cover the IPL portion of it. So if we do that, and I have a lot of patients who do that, we submit part of it to insurance and then the IPL portion is out of pocket. And other questions?
What's the difference between the Fraxel and Clear and Brilliant Fraxel, and what determines whether one is used over another? Can we treat suntanned olive skin?
Yes, I can treat olive skin. Suntan skin, we don't treat with light. So if you have a suntan, we have you let it go away. So we usually wait 2 weeks and here's a little stain. 2 weeks and then let the tan go away. Then we treat you for any modality. Besides an ultrasound modality that we use in the office. And that's the soft wave. But for Clear and Brilliant versus Fraxel, they are both the same laser, they're both the same wavelength. However, The Clear and Brilliant is a lower powered version. So the lower power means that it's gentler. So the results are not as dramatic. However, the downtime is less dramatic. Usually there's just 1 day of downtime for the Clear and Brilliant, where there's 7 days of downtime for the Fraxel. And you still get great texture results with the Fraxel and great pigmentation results. I'm sorry, with the Clear and Brilliant, and great pigmentation results with the Clear and Brilliant, just not as dramatic as the Fraxel. So I call it like a baby Fraxel.
Another question. What peel protocol is best for large pores?
For large pores, I would recommend the Vitalize peel. It is great for everything, but for the anti-aging portion, it's going to be a little bit stronger. So per peel, I would say the Vitalize is probably the way to go. How you doing, my dear?
Good.
Awesome. She's not bad for a rookie, is she? You're just so calm and collected. This is great. Okay, that looks great. I'm coming to the other side. Any other questions?
I was wondering if you ever have in the use of oral and acid.
Yes, we often do add it for melasma. For melasma only. The tranexamic acid has a pretty good safety profile, but there are certain risks. We worry about the pro-clotting effect of the tranexamic acid. So we do undergo a screening, medical screening, and some blood tests before we start it. And the problem with oral tranexamic acid is the pigment does tend to come back after you stop it. And so, you know, it can be an issue because many patients don't want to take it the rest of their lives. But it really does work. I think you're all fixed up. You're welcome. So we will send her before and after pictures to you in a few weeks, just so you can see what her improvement is. And then also, if you would like to schedule, please call our cosmetics number. It's 480-651-4989. And it is really, really a great treatment. These are all great treatment options. We really would love to see you in the office. So please also, if you have any questions, feel free to call or email us. And one other thing, do they respond directly to the email, or do they email a certain email? I think there was some confusion over that last time.
You can email cosmetics@cleardermatology.net.
Okay, cosmetics@cleardermatology.net if you have any questions. Thank you guys so much for attending.